Dr. Stone counseled me with was the opportunity for Biologic injections, which I did, and I've seen pretty remarkable results right off the bat. Within 48 hours, and saw some improved range of motion, decreasing pain when squatting, the ability to squat. My name is Chris Clark, and I've had some challenging knees. My right knee, I tore my ACL in 2005 and had a patellar graft, which I damaged again in 2018, and opted not to have surgery. I was doing fine for a few years there. It's now 2022, and I started to feel some pain in that knee. It looks like maybe some arthritis. There's some stuff that Dr. Stone can clean up in there, but it's pain and loss of range of motion. and so what Dr. Stone counseled me with was the opportunity for Biologic injections, which I did, and I've seen pretty remarkable results right off the bat. Within 48 hours, and saw some improved range of motion, decreasing pain when squatting, the ability to squat. I couldn't do that before. I couldn't pull my knee up to my chest or cross my legs with my right knee. And now I'm a month out, and the improvements are there, maybe even better. Looking forward to seeing how this progresses over the next coming months. And similarly on my left knee, I had some pain after a ski trip this past winter. Sounds like there might be a cyst and some arthritis on that knee, and also did injections there. And I'd say both knees were pretty challenging. I was icing every day. Anytime I did activity, there was probably 2 days of pain afterwards where I would wrap my knees in ice sleeves. I'm not doing that now. I'm probably more active. I'm playing several sports: softball, baseball, surfing, skiing, riding my bike, so the injections definitely have led to an improvement in quality of life. Able to both knees, range of motion. I can pull my knees to my chest. I can squat. I'm also pairing everything with a physical therapy program here, which is helping. I need to be doing more of that. I'm not as consistent with my physical therapy, but between the two, the injections and the physical therapy, I'm definitely seeing significant improvements. Within probably 48 hours, I was seeing some improvement, and I was, when you have the injection, your knee, there's fluid in your knee, so you lose maybe some range of motion. There's some tightness in there. It's not painful, but it's noticeable, and as that works its way into your system, or at least in my system, I started testing the range of motion and the ability to squat, and Allison here in the PT team gave me some exercises I could do that would also relieve some of the pain as I squat. So combining those together, I was pretty impressed with how much range of motion I saw improving within 48 hours. And then as the weeks have progressed, I'm about 4 or 5 weeks out now, I've seen less pain after activity, definitely not pain in activity, and just a general improvement in range of motion altogether. I haven't had stability issues going into it. I felt pretty stable going into the injections, so that hasn't been an issue for me, but it's really been more about pain management, while I've got a knee that is impacted by several years of hard activity. Did some stuff this year that started to cause the knees to be painful. I started playing new sports that are probably hard on the knees, softball and baseball, running on hard dirt. And that, I think what I was really worried about at the time is that, oh no, I am rapidly progressing into an arthritic or state where I'm going to need to get surgery on my knees. What I was relieved, what I've been relieved with, is that these injections have, at least for the time being, and we're about a month out, have dramatically reduced the amount of pain. I'd say I'm probably like 85 to 90% of where I was 8 months ago, where I had no pain before I was playing these sports.
Oh, hit the booter.